This November, voters in Massachusetts will have ballot measures before them. Question 1 calls for there to be limits on the number of patients that a nurse can care for at one time. The Massachusetts Nursing Association is the union backing the proposal, with representatives saying it will improve patient safety. We take a look at both sides of the issue, beginning with those in favor of question 1. Carolee McGrath sat down with union steward Emma Dragon, a registered nurse who works at Cooley Dickinson Hospital in Northampton, to learn her perspective.
Question 1 is a bill that was written by nurses, for nurses. It gets back to the root of patient safety and consistency throughout the entire acute care health system. We really believe that the hospital system has become more profit driven rather than consistency in healthcare delivery to our communities, and that's really what we want to get back to.
And what do you see specifically as a nurse? I know you've been a nurse for about 10 years, you work in the emergency department. What do you see?
So over just my short 10-year career, even in that time, there is increasing staffing needs. The patients are so much more sick. If you're staying in the hospital, it's because you're too sick and too ill to be cared for in the community or in another setting. You need the consistent evaluation and monitoring and implementation of advanced procedures by nurses. Hospitals, even though nurses have continually tried to work on staffing with them, aren't really able to have accountability and facilitate change with that. And that's what we need to get back to.
So is it overwhelming? You're overworked when you walk in? And what does the caseload like?
Absolutely. So the majority of nurses in Massachusetts don't work in the hospitals and acute care because we're overworked. There's this moral fatigue that we all suffer by not being able to provide care the way that we need to. For the reason why we went into nursing as a career. A lot of us went into it, as with many other things, because we had a calling. And when we're not able to deliver and connect with people in the special way that the art of nursing once was.
You know, some people who are against this will say, listen, you know, why does the government have to get involved with this sort of a mandate? Shouldn't you leave it to nurses on the floor, nurse managers who know the needs of the patients, you know, who know, which patient needs a certain kind of care? Why does it have to be a government mandate?
Absolutely. So nurses and hospitals have been working together for many, many years, having staffing committees where we review unsafe staffing reports that nurses routinely file because of unsafe conditions for themselves and their patients. Nothing is changing. If this staffing issue wasn't a problem, it wouldn't be on the bill today. There needs to be a third party that is an objective third party that's able to facilitate institutional accountability and really create a system to make it better for everybody.
And let's talk a little bit about the community hospitals. The community hospitals have really raised some concerns that they would really have to cut back on services and that it just wouldn't be sustainable if this went in place. How do you respond to that?
The hospital system and hospital association in Massachusetts showed $28 billion in profits last year. This is not a issue with true finances. This is a distribution problem in terms of where they're placing their money. There are CEOs in the state that make millions and millions of dollars, and we need to bring that money back to frontline care where it's important.
So the Massachusetts Health Policy Commission released a report saying it'll cost up to $950 million a year once this is put in place, which was consistent with what the opponents of question 1 had put out about the costs. That's a concern for people.
Absolutely. And we can certainly hear that, how anyone would be alarmed with that kind of misinformation that's given to them. It's really a skewed study where a lot of their values and data misrepresent the true nature. In part of it, it's stated that Massachusetts hospitals rate over California in 5 out of 6 nursing core measures, and the variance of that is 0.14, which really should have been shown as insignificant data.
But it's a great big difference from the number that was put out of about $47 million that it would cost to implement.
Yeah, in the Health Policy Commission's review, they also talked about current nurses and what their projected hiring would be, also one-time analysis of implementation of acuity scales and tools. The initial findings and really the root cause of this should go back to what is going to be our financial strain or value with all the hiring of the estimated 2,500 nurses.
Okay. Talk a little bit about, the ratios as far as like the emergency room, because that was another concern that has been raised, that there's going to be a longer wait time for different types of services.
Absolutely. So the real response to that is the more hands on deck, the less time there will be to wait, because there's going to be more nurses to take care of you. There's going to be less delay between that nurse getting to you to be able to give you your pain medication or do that assessment or respond to your family members. Really, more nurses is going to equal less time.
And what is the ratio for the emergency department?
Estimated in the bill, I believe it's 1 to 4.
So, but what if you're like that fifth person and there weren't enough
Absolutely.
people on call that night, and you're waiting there, to be seen?
Sure. EMTALA is a federal mandate. The Emergency Medical Treatment Act that was placed in 1986. It mandates the treatment for anyone who presents to the emergency departments and medical screening for that, regardless of how sick they are or if they can pay or have health care coverage. Every patient is going to get treated exactly the same way, if not better, than they do today.
Okay. Yeah. A recent poll by Boston Globe showed that 51% of the voters oppose this measure. How do you convince them that they should vote yes on question 1?
For us, and for me especially, it's about getting back to people and not profits. It's about us all valuing our family, our community members, and how much that matters more than money, and fixing a sliver of our broken healthcare system.